Good morning. I'm Janie Parrish with the Wadsworth Area Chamber of Commerce, and I want you to know you're going to have a very interesting interview here on this podcast. But I wrote the names down because, after all, I am Janie from the Chamber, and I have a bad habit of messing up names. And so these are not familiar to me, so I wanted to make sure that I said them correctly. So both of these girls are from Alternative Pass, and over here in the black is Dina Meslovich, and she's a Prevention Services Support Staff member. And then this is Taylor Volovar. Yeah. I did okay on that. Community Prevention Specialist, and both, as I said, with Alternative Pass. So I can put my notes away now, and we can just visit. So good morning to both of you.
Good morning.
Good morning.
Oh, so glad you could come, because a lot of people, they've heard of Alternative Pass, but it's good to get from the staff members exactly what you do. So if you can tell us about what you do, that would be terrific.
Yeah, so Alternative Paths is a mental health and behavioral health nonprofit organization. So we do counseling, case management. We run the crisis line for Medina County. We do prevention services, which is what Dina and I both do.
Nice.
So am I missing anything?
Not really.
Okay, so where are you located?
Yeah, we have a bunch of different locations.
Oh, I did not know
Right.
that.
Our primary location is in Medina, but we have offices in Brunswick and Wadsworth and Lodi.
Now, where are they in Wadsworth? Where's your office in Wadsworth?
I wrote that address down so I didn't mess it up. One Park Center, Suite 207.
Nice. Everybody knows where that is, in front of Bob Evans and the Galaxy.
Right.
Yeah.
Yeah, there's a small office there, and we have counseling by appointment.
By appointment, okay. So say, for example, if I were to get in trouble by using drugs, we'll start with that. Would you be a resource that I could call?
Yes, absolutely. We do a lot of recovery support.
Okay, and when you say recovery support, is it group or is it individual? How does that work?
Yeah, so we do individual, and then we also, I believe that we do we do groups?
I don't think we have very many groups. I think we
Okay.
refer out.
Okay.
A lot of, if we don't have the services, we'll refer out.
Okay, and how are you funded?
Yeah, so we're funded through grants, and then Medina Health and Recovery Board also gives us quite a bit of funding.
Oh boy, you need funding.
Yes,
Yeah.
definitely.
So if I were to come to you, what would be the process? I would call and say, I'm having issues with drugs and alcohol. What would be your process for intake?
Yeah, so whenever you call our primary number, then the receptionist will talk to you, and then we'll send you out through there for a counselor that works with recovery.
Okay, so would we come to the office then? Do you do phone? How do you get with people?
Yeah, it could be either one. I'd say phone is obviously a lot faster, might be easier for some people, but also the staff is really friendly. So if you stopped on in an office, they would help you there too.
They would just say, let's go here.
Yeah.
Yeah. Now, how do you charge for your services?
We accept traditional insurance.
Oh, nice.
And other state funding. We don't turn anybody away. So if we can find, someone to help them, we most definitely will. And that kind of ties in with our crisis services, because if you do call that line, it's the same number as the main line.
Okay.
They'll be able to put you into contact with somebody who knows where to send you and how to handle it.
You're like a big resource center as well for people, and you can find the different resources because I'm sure there's an overarching large problem that you can look at, but I'm sure everybody's different and requires different things. So it's a good thing to have all the resources available to you so that you can hop right in there and get going.
Correct. And we do have services that we offer at the Juvenile Detention Center and then also
Nice.
at the jail. So we have relationships, contract, I think, to be their provider. So we have all kinds of connections that way. We even have, crisis, or I want to say opiate. We have an opiate response team. We have several teams that are out there to address the issues.
Well, I know you have an excellent reputation for the work that you do, and so everybody says thank you, because even if it's not you yourself who's struggling with the addiction problem, you know somebody who is. So thank you for doing all of that that you do. So are there? This is what I always worry about with different. I shouldn't say worry about, but this is what I am concerned about for different organizations that that deal with individuals. Would you stay with the same people that are helping you? Does that make sense? I like to know that when I go to a provider, that I'm going to see the same provider. I like to build a relationship. So that's what I'm wondering. Do you try to keep that going, the same person relationship with your client?
Yeah. Absolutely.
Oh, good.
Definitely. It also depends a little bit on like what your situation is. So for a crisis line, for example, if you call that, there's going to be somebody who's on call. So whoever answers that call might not be your provider later on.
Okay,
And then
sure.
whoever does intakes might not also be your provider later on. But once you get settled into a counselor for whatever it is, then you should be able to roll through there.
So before I came to the Chamber of Commerce, I worked for Hospice of Medina County, and I always appreciated that they tried to keep the same team, because you do develop a relationship, and I think the outcome is always better if you have
definitely.
a relationship. So I'm loving hearing you say that that's exactly what you do. Yeah. So what makes your crisis hotline, your interventions, different from others? What makes you unique?
Well, I would say we're the county's crisis service line.
Okay.
So not just alternative paths, it's everybody in the county can contact this number and receive services.
Boy, and when you say it's a 24-hour hotline, how does that work? Do you have somebody there? Is it an answering service? How does that work?
There's someone there to take the call.
That is so nice. Yeah, because sometimes when you do call in after hours, not a hotline, but it's hard to get an answer. And I would think that if you're calling after hours, that you're in need of help. Mm-hmm. Yeah, pretty
Yep.
quickly. Yeah, you need somebody to talk to.
Sometimes you just don't even know what resources you have available to you. It's kind of like you're entering a new realm, and
Sure.
you need help just navigating the system. So that's also part of the process, the case management throughout, and
Yeah, and
any intervention that needs to be made.
so, and I'm sure every person is different. Like maybe you could be on your program for 6 months, or maybe 2 weeks. That's 2 weeks is probably not a good number. Yeah, but I'm sure everybody is different in their recovery.
Yes.
Definitely. And then we also offer youth services as well as adult services. So if there's anybody under the age of 18, so they can seek youth services, and then we can also have them as an adult. And I know that some other places don't offer that, so it's really special that we're able to do so.
That is. Now, what about, do you have services for children of parents who are in recovery?
I don't think specifically for parents who are in recovery, but we offer parenting classes currently, which is a different topic. But
Yeah, no, that is awesome, because you can't have enough good parenting skills, no matter who you are. Yeah.
definitely.
Now, so you do fundraising as well, because you have to. Yeah,
Absolutely.
when you're a nonprofit, you have to do fundraising. So what is that you do for your fundraising?
Yeah, so Alternative Paths kind of hosts the Medina County Coalition for Suicide Prevention. So we do fundraising specifically for that, not necessarily just for our agency. So we'll host fundraising opportunities for that. One example is our upcoming Step Up for Suicide Prevention walk coming up September 21st. That's a Sunday. So there's donations available or sponsorships available.
And so tell us how that works. Is it on the square in Medina?
It's on the Medina Public Square.
Okay.
You can register online on our website, or you can register the day of the event. registration is no cost to attendees.
Okay.
And the first 500, I'm not sure how many, will get a T-shirt.
Oh, boy, I
and
love
we'll have
T-shirts.
people there having tabling with throughout the community. Those members on the coalition, like the health department and the VA and so forth, who are part of our coalition, will be there too. And we'll have a speaker, several speakers, but we have one speaker coming in to talk about the loss of her son, which will be hard to hear, I think, but
Sure.
encouraging in the things that have changed along the way for this family.
Sure.
So, we have those stories of hope and resiliency, and then we go on a little walk. It's not very far, it's 1 mile. And really, I attended last year for the first time. I just started at Alternative Paths in February.
Okay.
But I did attend last year, and it was so moving and so powerful.
And you probably still think about those stories. And
I do, actually. Part of what drew me to this prevention work was that, we're trying to get education and outreach out to people who might need it, who might be struggling. So I really enjoy that part of it. There is good
Sure.
in this. Yeah.
Because it's always the awareness that that help is out there, that to get that information out so that people can benefit from your wonderful services. Yeah. Now, how can people find you?
Yeah, so we're on a few different social media platforms. We do Facebook and Instagram. The handles are just Alternative Paths. You can look it up.
Okay.
And then we also have a website or our phone number, which is 330-725-9195.
Now, you don't need a doctor's referral or anybody's referral. You can just call and say, I need help.
Absolutely.
Okay, and that would be good. And then also, if people want to sign up for this walk, you told us exactly how to do it, so that's on the website. Yeah. And you can bring donations. You ask your friends and family if you would like before you walk to turn in. And then, but I'm sure you're out.
Yeah, we're not specifically asking people to raise
Sure.
funds, but if they were, so moved to donate, that would
Yeah.
be okay. And we have sponsorships for the event. So we have several sponsors right now that
Okay.
will be present. You'll see them soon on our social media and
Good
our
deal.
materials and so forth.
Well, your work is extremely important, and the nice thing too is it's not just the person with the addiction that you're helping. It's their family, it's their friends, it's their future. It's just a big ripple effect. Yeah. Now, for the office here in Wadsworth, are there specific hours that are here that they could walk in, or is it just all appointment?
It's by appointment.
By appointment, okay. So there's no we'll be here every Tuesday from 8 to noon. No, it's just
Right, it depends on scheduling, yeah.
Got it, because, I'm sure you're not overstaffed. There isn't a nonprofit in this world that says we have too many employees. That's for sure, because as we all know, when you work for a nonprofit, you wear a lot of different hats. Yeah. And also, one of the things that I like about working for a nonprofit is your family's dragged into it too.
Definitely.
Definitely. Yeah, we're doing a parade, we need some help. We're doing a fundraiser, we need some help. And it always comes from your family. Yes, that's for sure. Well, Dina and Taylor from Alternative Paths in Medina County, serving the whole county, thank you so much for the education about what Alternative Paths do. And thank you again for your good work.
Thank you
Of
for
course.
having us.
Thank you so much.
You are watching WCTV, Wadsworth Community Television.